week of educational meetings with our staff. We had a great turnout. It was a super entertaining lecture. So if you're interested in seeing the whole thing, you can log on to the link and see the whole presentation. But it was super entertaining because it was conducted by Kelly Palmer, our fixed anterior manager. Kelly, I was surprised, and I wasn't surprised, I guess I knew this, but it was awesome to hear. 20 years?
20 years.
You've been doing this. Tell us a little bit real quick about yourself.
I have a background in fine art, ceramics, and needed to pick up some part-time work between teaching jobs and answered a small ad in the paper. Artistic, good with your hands, call this number. 20 years went by pretty quick. So shade, contour, those are my sort of bread and butter skill sets. And it was a great blend of art and science, really.
You did a great job in this lecture. Your teaching experience definitely showed up, as well as your quick sense of humor. I know we talked a lot about what we do in the lab to help our customers with contacts. We have different preferences from clients. We have an elaborate system for controlling contacts and having, if somebody wants contacts super tight or super broad. Tell us a little bit about that.
I mean, it starts with good communication. A new account, we should find out what the doctor prefers, tell him what our standard is, and then go from there. These numbers get plugged into our design group, into our carving group. Everybody's on the same page, so with a simple communication, we know what you want, and after a few cases, we can really dial that in and get you what you need. Minimize chair time. I
know you showed we have an elaborate system of codes for contacts to basically communicate through, and it's just super important for people to read those codes. And then when a doctor is seeing things changing, maybe something changed on their end, now contacts are a little tighter than they used to be, they just give us a call and we make a change, huh?
Yeah, everybody knows. Usually we make an announcement, hey, this doctor is having this problem. Let's make some changes, keep your eyes peeled for it, and let's solve the problem.
There's a lot of things clinically that can affect contacts, can affect their tightness or not the position, but certainly the amount of contact it has with adjacent teeth. What are some things that happen in the dental office or that we see that the doctor can keep an eye out for?
We need great, clean impressions. Hopefully, your temps are stable. With a contact similar to what you want in your crown, and let's get it in here and get it back to you as soon as possible, just to make sure nothing is shifting and as little time goes by as possible.
So if a tray bends, that can affect the contact. If temporary is out of occlusion or the contact gets too loose.
Hitting a tray, yeah, a lot of things.
Now that we do almost all of our restorations in some digital way, how does the speed of what we do help with the contact problems?
Theoretically, the faster it's back and seated, the less likelihood there is going to be trouble. Teeth move.
Yeah. So that's why most of our crowns go out in 3 or 4 days. Anteriors we take much longer because we put more scrutiny on them. He appreciates as much time as possible on anterior cases to make sure we can do the best job we can. But simple posterior crowns we do really pretty quickly, so you can almost turn those around in a week. Pushing patients off 2 months can cause problems. So I know you mentioned you're in a lot of different online forums for digital technology, dental technology. You mentioned a funny case about somebody in the Netherlands that a doctor asked for a banana contact. Which it wrapped around the tooth, and we use that as a kind of a funny example of what's not to do. But sometimes we do. At the end of the day, we'll do what the doctor requests, assuming they have good reason behind it.
Yeah, that's what it's all about. If you have special requests, we need to know, and we can accommodate a lot of them with our digital team as well as our hands-on carving, contouring team.
I see you up with the technical support specialists a lot, having them call doctors. For example, like a 6-unit case where there's a large distal space, maybe teeth had shifted, and I think more communication from the doctor would be really helpful to prevent us from bothering them with these calls.
Yeah, time is money. We want to get the right answer. There's a lot of 50-50 balls that come in. We just need explicit instructions when there's going to be a potential question. We just need to know.
Yeah. So if you're they're reaching on a contact, again, based in the temporary, or they want to leave a diastema, I mean, they got to tell us that. There's places on our prescription to
Yeah.
ask that question. But those little things, we're going to call. If there's something unusual that's not anatomic, you know, that we're going to do, we're going to call, right?
Yeah, makes the most sense.
So do we have all this information on contacts documented?
We do. Part of our DAMAS certification process is repeatable, verifiable results. Technicians are audited on a yearly basis on how they do things and what they're doing, and it's all documented.
And that just delays the case and get things going. So, well, great job today. Great job with everything you do, and thank you very much.
Thank you.
All right, this concludes our little interview.
To receive a copy of this lecture, visit www.rodentallab.com/ROE Reviews.